Hello, and welcome to this webinar for the release of resources to support implementation of the National Safety and Quality Mental Health Standards for Community Managed Organisations. My name's Andrew Moores, Acting Director for Mental Health at the Australian Commission on Safety and Quality in Healthcare. The Commission is on the traditional lands of the Gadigal people of the Eora Nation, and we pay our respects to the traditional custodians of the land and recognise their ongoing connection to land, waters and community. We pay our respects to elders past and present and to emerging leaders, and we extend that respect to any First Nations people who are joining us today. The Commission also acknowledges the contribution of people with lived experience of distress and mental ill health, their families, carers and support networks. I'm joined today at this launch by people who've helped us develop these resources. Sharon Lorne, Executive Director at Lived Experience Australia, Corinne Henderson, Director, and Katie Sam, Project Coordinator at the Mental Health Coordinating Council New South Wales. Welcome everybody, thank you for joining.
Thank you.
Thanks.
So the CMO standards were released in November 2022, and we've been working with key stakeholders to develop resources to support their implementation. So people have had an opportunity to familiarise themselves with the standards, and now we've worked to provide additional information that consumers and carers can use to understand what the standards mean for them and how they can contribute, and a guide for service providers which has a lot of information about implementation strategies. So briefly to recall, the CMO standards include practice governance, partnering with consumers, and model of care. And across all of the actions in those standards, we've now developed information that helps people to implement. Today, we're going to be talking explicitly about the consumer and carer fact sheets, the guide for service providers, and an accompanying self-audit tool. First, let's look at the fact sheets. Sharon, you developed these with colleagues at Lived Experience Australia. Can you tell us a bit about Lived Experience Australia?
Yeah, thank you, Andrew. Lived Experience Australia is a national representative organisation for people with lived experience of mental health concerns. We're an organisation which is wholly lived experience, so we have people who have lived experience as a consumer of services of all types, but also family, carer and kin. We have a friends network of about 6,000 people or so across the country who we hear from. Our main business is really to elevate the voices of lived experience. We think that that's crucial to have lived experience expertise in the mix of reform of policy and service delivery. So that's essentially what we do. We have a lot of fun. We really enjoy what we do. And this was a great project to do with the Commission.
So thanks for that. Can you tell us a bit about developing the actual fact sheets?
Yeah. So the first important thing that we did, we had a fantastic team of 10 people with lived experience, either as a consumer, as a family carer, or as a peer worker. And of course, in this area, many people hold all three hats, or at least one or two, or three. So we worked alongside a group. We met routinely through the whole of the process at the start and through each step, and they helped guide us in what we actually needed to do for these fact sheets. So in addition to that working group, we held 9 focus groups, and also did some in-depth interview where people either couldn't turn up for a focus group or they wanted to give us an in-depth understanding. We asked participants in the focus group 4 key practical questions. The first one of those was, well, what would it look like to be a consumer receiving service according to these standards? That was the first important question. The second one was around if you were asked to actually be involved in the co-design of a service in order for it to meet your needs and meet the standards, what would you want to know about the process of that? The third one was if you were actually interviewed by the accreditors that were coming out to the service where you receive service or your family member receives a service, what would you actually want to know? For example, you know, how would you prepare? How would you understand what they're going to ask you, etc., etc. And the fourth one is really about how would you like the information in these fact sheets to look like? What would be accessible to you? What would help you to understand what the standards and the process is actually all about?
Thank you. And can you tell us a little bit more about the focus group participants and who you were speaking with?
Yeah. So we deliberately ran quite distinct focus groups with a range of different groups. Of course, we couldn't reach across every single particular group involved because the CMOs themselves are a very diverse network. But we certainly spoke with young people. We had a lot of fun with them. And we spoke with older people. And we spoke with peers. We spoke with family and carers. We spoke with people in rural areas with their unique needs, people who were recipients of NDIS, First Nations and culturally linguistically diverse groups. We did that in a mixture of face-to-face and online focus groups. In all, we spoke to about 50 people. So together with our 10 people from the working group, we covered, we hope, a reasonable amount of ground. People agreed that the fact sheets and the poster related to that should be in English, plain English. We certainly had an interesting conversation around First Nations and CALD, or culturally linguistically diverse groups. The people were very conscious of the issue of these needing to be generic fact sheets, but also to capture the diversity, which was certainly, you know, it's a good challenge. But equally, they didn't want things to be so individualised that it made particular groups stand out. Trust was a very important point that certainly came across by all of the conversations we had. Certainly trust in what they shared with the accreditors, trust in the process itself, which some people felt, you know, could be potentially traumatising for some people, put people ill at ease, particularly if they were recounting dissatisfaction with the service. Young people had a really strong emphasis on, they really wanted to know. So clear service inclusion, exclusion criteria was important for them. Transparency in the process was important. Honest, open communication, so they absolutely knew where they stood. They were a really interesting group. The emotional safety was certainly raised as a point of concern for all of those people that we spoke with. And people recounting their experiences of service. So it wasn't just that they would be asked their view and then that would be the end of it, like extracting information. You know, it's the after that's as important as the preparation and the doing of speaking to accreditors.
Thanks, Sharon. It'd be good now to hear from somebody who's actually had experience of using services, what the fact sheets are like for them. Now let's hear from John.
Welcome, John. As a consumer rep, do you want to give us a bit of your sense of why it's important to have safety quality standards for CMOs?
Yeah, absolutely. Thanks, Sharon. The idea that safety standards aren't just a sort of a policy that doesn't have an impact on the ground. I'm sure most of us would think that way, but in reality, when you are dealing with mental health support on a one-to-one or on a as needs basis, it's so difficult to feel like you're in a safe space. It's not easy to seek support. It's not easy to admit that there's something that isn't working for you, and knowing that the support you do end up engaging with has some awareness of what you need and follows those structures and follows best practice really is a point of comfort for somebody who needs that comfort at a time when things can be quite challenging across the board, when life can be really quite chaotic at times. So that they give you a sense of safety, a sense of structure, and a sense of well-being. Just that security.
Yeah, pretty important.
Yeah.
Particularly as someone who's using services, you have a lot of questions about what's going to happen, what to expect, how much control you might have in the engagement with the service, whether they're going to listen to you, a whole raft of questions that people no doubt will have.
Yeah, absolutely. Particularly you mentioned control and questions. So you don't know, you've never used this. This is an unknown territory. And being able to access fact sheets that contain information that is not just relevant to your situation, but is actually readable, accessible, right? It doesn't use terms that are medical terms or scientific terms. It uses terms that you can, understand in relation to your own requirement.
Even the term accreditation, when we sat down with our working group, that was the first thing that everyone realised, is that many people won't even know what accreditation, what is that as a term.
So true. What relevance does it have to me? So I now know through the fact sheets that accreditation confirms to me that the group and the people that I'm working with actually have a really good understanding, and they've been put through education and information that is relevant to my experience, not just some medical basis, but they actually understand the consumer's requirements on the ground, how to keep us comfortable, how to keep us feeling like we're being served, and creating a partnership. Because working with someone in a mental health space really needs someone you can rely on, someone you can trust, a partnership.
Yeah, it's a big thing to give service feedback.
Absolutely, yeah. And once you're going through, being able to pass on your experience, not just because it's you want to help, and it's part of being a good consumer, but it's also inspiring to feel like you can pass on information that will be taken seriously, that goes into the system and maybe changes things for the better for someone else.
It's the one thing that we hear often from people is, I just want to make a difference so that services are better for everyone that comes after me.
Absolutely. And just on a small note, it somehow really improves the circumstance. So it's, as a part of recovery, it can actually feel really good to know that your experience has helped improve the lives of somebody else.
Well, it was great to hear from John. That was such great feedback on the fact sheets. Corinne, Katie?
Well, I think it's lovely to hear how consumer expertise has been so valued and respected in the process of developing these resources. It sounds like a truly genuine co-design process.
Yeah, I think that hearing John say that his expertise is going to be informing the needs of other people in the future, that is the true core of meaningful co-design, and that's what is evident in these fact sheets.
And certainly for me, he brought up the issue of trust and people needing to know, about the process. So that equally goes for family carers, but also peer workers. We know in the CMOs there's a lot of people employed for their lived experience, and they've got a very particular role with the safety quality standards, because they're not only representing lived experience, but they're also an employee of the CMOs. So some really interesting things that the accreditors are going to be interacting with people about. So people really need to feel that they understand the process.
We've really enjoyed working alongside Lived Experience Australia, and very excited to be releasing these resources. Let's move to another resource now, which is the Guide for Service Providers. And Corinne and Katie at the Mental Health Coordinating Council had a key role in the development of the guide. Can you tell us first a bit about the Mental Health Coordinating Council?
Well, thanks, Andrew, for inviting us today. The Mental Health Coordinating Council is the peak body for community managed organisations in New South Wales, and our members generally provide psychosocial supports to people living with mental health conditions. We're also a member of Community Mental Health Alliance, which is the alliance of the 7 state and territory peaks across Australia. We've got membership of about 700 members across Australia.
And when you went about developing the guide, can you tell us a little bit about your early thinking about the standards and what the guide would include?
We know that the promotion and delivery of high quality services is an important safeguard against the risk of significant harm for people living with mental health conditions. So it was really important to highlight that providing people with quality supports and services in a safe and competent environment with care and skill is an important obligation for all organisations and is fundamental to the rights of people living with mental health conditions.
And that's fantastic. Can you give us a brief overview of the guide itself?
Yeah, so we're going off of the standards and the 82 actions which are outlined there. And for each of those actions, we've helped kind of translate them, giving explanatory notes, key tasks to consider, examples of evidence and details about where to go to for more information. And the resources help try and make it accessible for people to understand it. It's different kind of media as well as examples of different policies. So the suggested tasks and examples of evidence used are provided as examples only because we know that the different types of services across the CMO sector are really broad, particularly the size and the scope of each service. And so service providers can choose their improvement strategies that are specific but also meaningful to their service. And so I guess it would change if an organisation has a governing body and they would need to kind of refer to their needs as well, whereas small organisations can make more meaningful strategies on the ground.
In their local context, yeah.
Just to add to that, since the standards are reflective of trauma-informed recovery-oriented practice, an approach, we are keen that the guide is reflecting that practice in terms of language and evidence. And we believe that CMOs will feel comfortable and not daunted by the standards by having the guide, which will give them the confidence to work more effectively with the standards and integrate them into their organisational policy and practice. The standards and guidebook incorporate a very positive culture of critique, self-reflective practice and professional development in CMOs, which will support workers' practice and foster a stronger and safer environment for people accessing CMO services. So we hold great hope that these resources will help support a very positive culture within organisations around safety and quality service delivery in ways that can support greater outcomes for people living with mental health conditions.
Thanks, Corinne and Katie, for that description of the guide. Be good to hear what the guide means for a service provider. And we've been joined today by Shane Jakupek, Senior Operations Manager at Nehmi National. Thank you for joining us.
Welcome, Shane. Thanks so much for coming today and joining us. Can you tell us a bit about your service?
Thanks, Corinne. Our organisation, like many similar organisations, is committed to continual improvement. This is not new, but access to a contemporary set of standards specific to the mental health sector and specific to delivery of services by community managed organisations is new and a real step forward for us.
CMOs have different organisational challenges to public and private services, and their work is informed by a trauma-informed, recovery-oriented practice approach. How will these standards in the guide reflect how services work and build relationships with people who use services and other parts of the service system?
Well, the standards do reflect this community connectedness and the relationship with people who use services, their families and community. I'm particularly pleased with the model of care standard, which reflects the breadth and service of activity that community managed organisations in the sector and allows for new service models to develop into the future. The model of care standard also reflects our commitment to measuring and evaluating what we do with these individuals who use our services and to build better networks with the services to meet their needs and aspirations. These are not new commitments for us, but we are pleased to see them referenced in a contemporary set of standards. The standards need to have a meaningful relationship to what services actually do in practice to be useful. I can already see that the community managed organisation standards are directly relatable to the services we deliver.
Bearing in mind the myriad of standards that CMOs have to meet, what are you hoping that the guide will provide to assist the audit processes?
It's really useful to have a guide that helps us break down each standard into manageable concepts for further helpful resources. One thing I really like about the guide is the number of links that it has to different examples, different practice examples. We know the sector is used to continuous improvement, but having a set of examples about how other people have managed that is really helpful.
Thanks for your feedback there. Services will have time to adapt to the new standards and familiarise themselves with the implementation resources, and we understand the Commission will also be available to provide support and answer questions. So thanks so much, Shane, for sharing all your experience and expertise with us today.
My pleasure.
Thank you.
So we've spoken about the consumer and carer fact sheets and the guide for service providers. Another very useful resource that we're releasing is a self-assessment tool for service providers to use. Straightforward Excel spreadsheet. And what the tool does is allow you to map your progress in implementation against each of the 82 actions in the standards. You can rate your performance, you can list examples of evidence to support your performance rating for each action, and you can identify actions that are not applicable to the services that you provide. So this is, of course, one of the big questions for the breadth of services that CMOs are offering. There will be actions in the CMO standards that your service won't have to implement. And there's going to be a really straightforward process for applying for non-applicable status for those. And part of the information that's in the audit tool that we're providing, but there'll also be information on a fact sheet. So if you're not delivering residential services or handling medication or handling finances, you don't have to implement those actions, and we'll give some really clear guidance for both the service providers and the assessors, so everybody's on the same page. In addition to the consumer carer fact sheets, the guide and the self-assessment tool, we're also developing a series of learning modules for assessors who will be assessing to the CMO standards, and those will be available on the Commission's website. So that is an overview of the resources that are being released this month. We anticipate that services will be implementing the CMO standards using these resources from July 2024, and assessments will be starting after that. You can use this QR code to go to a landing page at the Commission's website where you can access all of these resources. And there's also information about how to contact the Commission's Advice Support Centre, where we can answer questions from any stakeholder who wants to ask about the CMO standards or their implementation. I would really like to thank Sharon, Corinne and Katie for their work alongside us in the development of these resources. We're really pleased and proud to be releasing them today.
Thanks for inviting us.
And thank you, Andrew. It's been a pleasure.
Thanks, guys. And we'd also like to thank you for joining us for the webinar for the release.